Project Hope is really a dream to change the history of cervical cancer in Peru. One woman dies every 5 hours in Peru because of cervical cancer, when we know that cervical cancer can be preventable with vaccines or doing good cervical screening. So the idea of Project Hope is the creation of a social enterprise that can provide a new model for cervical cancer screening that can be offered to women that can pay, but that can be also available for women that cannot pay through the social component of this enterprise. So basically, what happened is that nowadays we have a molecular test to detect HPV, which is a virus that causes cervical cancer. One advantage of this test is that it's very reliable. It's very good because it has very good sensitivity. It can be done by the women in the comfort of their house by self-collection of the sample, and it is very stable at room temperature. So in this model of Project Hope, what we are doing is we have this test, and with each test that we can sell, we can put this test in the hands of the women that cannot pay, but through a very interesting model. So we are identifying basically in the community, women that would like to help the rest of the community. And we train them on cervical cancer, communication, how to be a good communicator, about the HPV testing. And what they do is they go and they find other women and talk to them about cervical cancer, the testing, etc. And they are offering the test at a semi-subsidized price. For each test that they sell, the Hope Lady will get a small amount that is the incentive for them to keep finding other women, to give them the results, and even to help them to come to the health centers for the treatment. So basically, we call it Hope, detect on time and save 2 lives, because one is the life that you can save your own life by buying the test, and the other one is the one that you can save because you buy the test and you help the social component. It is not enough to have a woman that has been tested and it's positive. We need to assure that that woman is seen and is treated. The biggest challenge at this point is how do we assure that every single woman that is found HPV positive is seen and treated. And for that, we need to think about also working in a new model and introducing new technologies. The impact of including technology like the pocket colposcope and the thermocoagulator will be huge. Why? Because we are already identifying the women that have higher risk. And from some studies that we have done, we have seen that unfortunately, because we don't have the capabilities, we don't have the technology to bring treatment, even when we have women that have pap smears that are really abnormal, high-grade abnormalities or cancer, less than 25% are receiving treatment. If we can place in the hands of the providers technology that is relatively low cost, that it is easy to use, that doesn't require electricity, and that can get to a small health center, and the treatment that also doesn't need electricity can be used by any provider, I think we can change really the story, and we can change that 25% to 85% or more of treatment.